Good morning, this is Dr. Shiloh. With Melania Trump's recent procedure in the news, I figured it would be a good time to talk about what embolization is and what type of products we use to embolize things. So embolization is a procedure that's been used for a long time by interventional radiologists primarily to block blood vessels. And there are various means of doing that. I'm going to just show you the three most common things that we currently use. The first is a coil, and this is an example of a tornado coil. You can see it has a tornado shape and it has all these fibers or hairs on them, and they help block the blood flow. They cause clotting when those fibers are in a blood vessel. We use those oftentimes in trauma cases to block off vessels that are bleeding, GI bleeds, etc. Another product that's used very commonly are these particles, and I'm going to shake them up a little bit. You can see them spinning around. They're made of plastic, they're inert, and they go in the body, and they also block off blood vessels. This is often used for tumors and may have been used, in fact, in Mrs. Trump's case to block off the blood flow to the benign tumor of the kidney that she had. And then finally, this is glue. This is actually medical grade glue that can be injected into the body and also clog up blood vessels. So again, to summarize, an embolization is a procedure where we block the blood flow, and we have various means of doing that. In a moment, I'll show some examples of cases that we embolize frequently, including an example of Mrs. Trump's reported angiomyolipoma embolization. So here's an example of an angiomyolipoma. This is what Mrs. Trump reportedly had. In the upper corner here, you can see this is a kidney. It's a CAT scan, and there's fat within it. We know it's fat because fat is dark, just like this fat around the kidney. And then the rest of the material is blood vessels and other solid tissue. And here's the image from the arteriogram where I have a catheter in the renal artery. We obviously went out a little further, but the tumor is this thing here sitting on the outside of the kidney, and we worried that it'll bleed. You can see there's some really abnormal looking blood vessels here. And then finally, this is a follow-up image of after the embolization, showing the material that is staining the tumor, and the tumor is clearly dropped in size, and this is basically a dead hardened tumor. This was all done through a small pinhole in the groin in this case, but the same procedure can now be done from a pinhole in the wrist. This is just another example of a very frequent embolization that we perform. This is for a benign condition called uterine fibroids. In the upper pictures here, this is an MRI. This whole thing here and here is a giant fibroid-filled uterus. You can see how much space it's taking up in the pelvis. It causes a lot of heavy bleeding and bulk-type symptoms like pressing on the bladder and the back, the colon, the spine. And then finally, here's images from the actual arteriogram showing the catheter coming in and into the artery that supplies this fibroid tumor, and it's on the other side, the left side. This was done from a pinhole in the wrist, and using the embospheres, which I showed earlier, we cut off the blood supply to this fibroid uterus, and the patient's bleeding and symptoms resolve very, very quickly as the tumors shrink over time from lack of oxygen and other nutrients that are within the blood.